Welcome to the International Society of Nephrology Pre-Congress Interview Series. I'm Augusto Santos Jr. I'm a nephrologist in Brazil and also an ISN social media team member for the WCN 2021. With me today is Dr. Sara Davison. Dr. Sara Davison is a professor and a nephrologist in the Faculty of Medicine in the University of Alberta, Canada. She is also the director of Kidney Supportive Care Research Group and also a master in bioethics and passionate for reducing the suffering of patients living with advanced chronic kidney disease. She chaired the KDIGO committee responsible for developing international recommendations for kidney supportive care. And because of these and many other qualities and achievements, she's recognized internationally as a leader in kidney supportive and palliative care. So welcome, Sara Davison.
Thank you. I'm absolutely delighted to be here with you today.
So your research is at the forefront of kidney supportive care, where you are recognized as a world leader. What inspired you in supportive care? And also, I would like to know a bit about your activities as a director of the Kidney Supportive Care Research Group.
So, unlike maybe many people that are sort of drawn to end-of-life issues, maybe near the later of their career, I think I've always been drawn to kidney supportive care very early in my medical training. So I've always believed the quote, to cure sometimes, relieve often, comfort always is the basis of the care we should be providing. And it was really out throughout medical school, and especially as I did my internal medicine and nephrology training, I saw so many missed opportunities where patients were suffering needlessly. And even as a resident, I was often drawn into family conferences to facilitate end-of-life conversations or mediate some conflict, which is usually around end-of-life issues. And so it was these areas that I was drawn to and wanted to dedicate my career. And I think one of the things I did was that immediately following my nephrology training, I did a master's in bioethics, focusing on palliative care. And it was the inaugural year of the program at the University of Toronto. And it was during this 2-year period where I really got to learn and reflect on many aspects of care, including the philosophy and the law. So when I started as a staff at the University of Alberta in Edmonton, right away, I was all gung-ho and I really wanted to start a kidney supportive care program. But so that was now, it's 20 years ago to the year. And I remember talking to my palliative care colleagues to help support this initiative. And the first thing they asked me that if they did this with me, what were they in for? Like, they wanted to know what the burden of pain and other symptoms were in our patient population. And of course, I couldn't quantify it for them except to say a lot. So I think that's where my research and my passion really began. Without funding or protected research time, I just set out to quantify the symptom burden of patients with advanced CKD. And it was like opening Pandora's box. We were completely we just didn't expect what we were going to find. But I still needed a lot more buy-in to develop the supportive care programs I wanted to implement. So very early on, what I used and what really inspired me was looking into and researching patients' perspectives and using patients' story. And this is when I first started, into my qualitative research. It is so hard to turn away from a person's personal account of their suffering. And so I started looking at how they wanted to discuss end-of-life care issues and how they wanted to engage in advanced care planning. And I really wanted to dismiss those those misconceptions that having these conversations led to, or inherently led to, false or loss of hope or increased depression. And I think one of the things that I did differently, which has really helped keep me going over the years, is that after each piece of my research, I took a step back and I started using the research findings to develop and implement programs in clinical care. So while this may have decreased research productivity, it was instrumental in promoting the rapid uptake of findings and actually changing the way we deliver care, which is really the ultimate goal. And that kept me going. So for example, after researching the burden of pain and symptom management, we instituted routine monitoring of supportive care. So their symptom burdens, spiritual concerns. After the advanced care planning piece, we developed an advanced care planning program and trained many care providers to facilitate these conversations. And it was really from this early work that the funding came, the protected time came, and then that was the birth of the Kidney Supportive Care research group. So in terms of my activities with the Kidney Supportive Care research group, they're quite varied, and it's allowed me to grow and expand. And I think one of the premises I've held true to is that about 2/3 of the time it's really spent focusing our activities on implementation science. So it's the development and implementation of clinical services, clinical pathways, and this is very time consuming. And probably only about 1/3 of the time is focused on more traditional research or traditional research activities, working with the data, writing the manuscripts and what have you. And we're expanding. I mean, at the WCN, I will be talking about our work with the conservative kidney management, but we're focusing on so many other areas now. Probably one of the major ones is prognostication. So we want to know how patients are going to do on dialysis pathways, how they're going to do on conservative pathways, and focusing not just on survival, but all the outcomes that are important to them. So how are they going to feel? What's their symptom burden, their quality of life, their functional status? And now we've also been asked to actually extend our activities beyond kidney care and apply our work to those with chronic lung, liver, and heart disease, as well as advanced care cancer. So I don't know, there's a lot of work still to be done.
That's amazing, because actually, as you said, much of this passion is going to be the theme of your talk during the WCN 2021. So you're going to be in a very special session talking on the development of a national toolkit for conservative kidney management. And I believe that one of our most important challenges is how to have patients become more involved with their healthcare decisions. So can you give us a glimpse of what you're going to talk and hope on how we can have patients more involved with their decisions?
Yeah, it's a key issue. And certainly in Canada, we have an amazing engaged nephrology community that is really committed to providing excellent CKM. So this work is really happening in partnership with the Canadian Society of Nephrology, developing this toolkit with a real commitment to including our patient advisors and getting extensive patient stakeholder engagement as we develop all the materials. And at a minimum, this is going to involve, and I'll be going through the components, but we will be talking about the importance of developing consensus on the core components of CKM, the clinical guidelines, key performance indicators, and also developing those education resources, both for care providers and patients. But we also need to develop implementation and evaluation tools. And I'll be sharing the resources that we've already developed because they are accessible freely and customizable to local context, which allows end users to link their specific problems and barriers to specific solutions. And this means free access for patients as well. I don't think access should be a barrier to information, because information is key. But the other really important thing I'm going to be doing at this talk, and I'll be starting with it, is I really want to start by defining what conservative kidney management is, and I hopefully be able to articulate clearly what its core components and what it's not. And I know the ISN has identified this as a real key barrier in the uptake of CKM globally, and certainly it's one of the core components of its strategic plan for integrated ESKD care, which has just been published. So I'm leading a group that's really going to be looking at this very issue, so that when we have a conversation internationally about how do we integrate CPM, we're all talking about the same thing. We know what it entails and we know how it fits into the other components. So I'll be starting with that piece and then talking about the toolkit.
Yeah, great insights, and especially the idea of involving the family of the patients, which sometimes is not on the plan. Sometimes we just focus on the patient itself, and there is a huge burden on the family of these patients, which sometimes we forget to address.
Absolutely.
Okay, so I thank you so much for your availability, Professor Sara. It was really a pleasure talking to you. I'm sure that your talk and your session is going to be one of the highlights of the Congress. And therefore, I invite all the nephrology community to join the session and follow the discussions, and also follow the ISN social media channels to get up to date and close to the latest developments of the Congress. Thank you so much for the opportunity. I'm sure the WCN 2021 will going to be a huge success.
Thank you so much. Thank you for your kind words, and I'm really looking forward to the engagement and expanding the discussion. Thank you.